this is Jessica DaMassa with WTF Health. I'm here with Dr. Petra Wilson. She is a co-founder and managing director of Health Conect Partners, which helps companies in the healthcare space address the legal aspects of data and security and compliance. So you are an attorney, which is awesome. We never get to talk to the lawyers. So welcome. It's good to talk to you.
Thank you very much.
Thank you for joining us. So I want to jump in right away and start talking about what is going on in this space, because there is so much happening with data, and a lot of healthcare companies are getting, their fingers in the pot here. What do we need to know in order to protect ourselves, to protect patients, to protect the health systems that we're working with? Talk to me.
Okay, so the first thing to say is that there is a lot of law around how data is to be handled, and it's there to help us in the business community. It's there to help us as patients. So the first thing I'd say is the law is your friend, not your foe. Make it work for you. I guess everybody will have heard of the General Data Protection Directive, new piece of law that came into force on Friday. You had a spam load of emails about, do you consent to this and do you consent to that? And I think that's frightened off a lot of people. The thing is that this is a really important piece of legislation that allows us to understand what sort of data we can collect, when we need to have a patient's consent, and we don't always need a patient's consent, what we can do with data beyond its original use, so so-called secondary use, and it can really help us build a strong business base in using data. And I think that's so important because data is the lifeblood of this digital health business.
This is so overwhelming to so many people, and it sounds terrifying. So it's like, are these laws are they global and applicable to all digital health everywhere? Is it based on country? Is it based on what type of application you're doing with the data? Is there any commonality for us to look into, or how do we tackle this?
Okay, well, actually the answer is yes to all of those in a certain way. So the General Data Protection Regulation is a piece of law that applies across all of the 28 countries of the Union, European Union. It also applies to a business that's not registered in the European Union but treats the data of a person resident in the Union. And note, I said resident, not citizen of.
What's the difference?
Well, you are actually currently...
I'm a resident, but I'm not a citizen. Got it.
Exactly. Okay. And so that's a piece of overarching legislation. However, you then have national level legislation in each of the European Union countries that addresses, for example, what sort of research you can do with health data. Then when you come outside the European Union, so for example in the United States, you have laws like HIPAA and HIT that dictate what you can do with healthcare data. However, if you're going to be sending data across to the European Union or bringing data in from the European Union, then the GDPR applies to you as well. So I'm actually working with quite a few US-based clients who've decided they're going to apply GDPR, even though strictly speaking they don't have to, but they think it will be good for business to show that they're compliant.
That's good business sense, especially if they want to scale out of the US, right?
Exactly.
Okay.
So actually that leads me on to the other big point, is start early.
Okay.
So even if you're based in the US now and you only have US clients, it's actually not that much difficult to, if you like, future-proof yourself against being GDPR compliant as well. So do it at the beginning and it'll be much easier than trying to bolt it on at the end.
Now, Petra, we have a lot of startups that watch us, and oftentimes it's one of these things where it's like, okay, two problems with this. Number one, I can't afford an attorney. And then the other one is, where do I find this? What do I even look for? Do I Google in data compliance attorney? How does somebody even begin to start? So first of all, address the affordability issue. How do we get around that?
Okay. Well, one of the things you could do is actually look at places like universities which support startups, or local business clubs that support startups, because they'll often have small friendly boutique lawyers who will work at a more reasonable cost. So my advice would be, at this stage, at an early stage, perhaps don't go to one of the big high street law firms the names of which you will know. Not only because they're more expensive, but then perhaps not so likely to really have that digital health element. You may need to use them at some point later, but start off with those and use your local business community to find boutique firms.
And then what am I looking for in those boutique firms? I can find a patent attorney, a trademark attorney. What's my search term for this?
I would put in a search term of something like digital health privacy, or digital health lawyer or something like that,
Okay.
and try and whittle it down. And, most lawyers will be very happy to give a first interview for free.
Okay.
And I think use that. Use that because it's actually really important, particularly if you're a startup, that you like your attorney, you like your lawyer. They're not just there when there's a time of stress. If you work well together and you can build up a good relationship, it'll really work well. So you've got to get on a human basis as well.
Are there any last tricks or tips that you can offer us from the legal aspect in terms of data and the privacy and security? We know that this is going to become a hotter issue as the years go on and data becomes more open to access. So is there anything else that globally we would need to know other than start early and with an attorney? Is there anything else?
Well, the other thing I would say is people get really hooked up with this idea of who owns the data. My big tip is don't think about data ownership, think about data stewardship. And I'll give you a very quick example.
Yes, please.
We're here at a conference. Pretty much everybody stayed in a hotel room last night. They locked that door and slept safe in the knowledge that they were able to sleep peacefully, nobody else could come in. They didn't claim they owned that hotel room. And it's a bit like that with health data. We have to be able to lock it, know who's got access to it, but thinking about ownership doesn't really help us.
I think that's very well said. It was so lovely to speak with you. I never get a chance to speak to an attorney in your space, and so this was fantastic. Thank you so much for joining us.
Thank you.
I'm Jessica DaMassa with WTF Health. Thanks so much.